Ka pai. So let's welcome everybody. Where's all the other people? Have they come in? Great. Okay, wonderful. Okay, so we're going to start with, if you are a community health and cultural service, could you please raise your hand? And that means you're going to go to the top of the screen and we are going to hear from you first. Fantastic. So in our list, we've got Asian Family Services, Chinese New Settlers Services, the Asian Network, Literacy Waitakere, St. John, New Zealand, Well Foundation, and Wilson Home Trust. So kia ora, thank you very much. We're going to start over here with you. Is it Shayal Ashvini?
Hello everyone. So my name is Ashvini and I'm a health promoter for ASHA at Asian Family Services. And I would like to take the opportunity to introduce Asian Family Services and all the services that's available through our organization. So AFS is a counseling support services for anyone affected by gambling or any other person like a family member or anyone who is affected by someone else's gambling. We also have 3 free sessions of counseling for any sort of emotional support, and from there we can refer them to an appropriate NGO. We also do a lot of public health work, so we try to educate the community about harmful gambling and just create awareness around us about the impact that gambling has on everyone. We also do a lot of social work. Currently, we're working with MSD funding and trying to help our community with food essentials and living costs. And this is regardless of your citizenship status or visa status. It's free. You just call us and then we help you with whatever that you require help with. Yeah, so that's all the services we have. And we have a helpline which is free, available in 10 different Asian languages, and it runs from 9 a.m. to 8 p.m. Yeah, that's about us.
Awesome, thank you so much, and amazing timing because you have 1 minute 45 really, and you did in 1 minute 30. So kia ora, Samuel, thank you very much. And if anyone would like to chat with you, please, they can message you directly in the chat box. Ka pai, kia ora, Samuel, thank you.
Hi, kia ora. Hi, I'm Samuel Jost, working at the TANI. I'm taking a role of looking after our health promotion teams. TANI stands for the Asian Network Incorporated. Actually, the TANI is largely committed to taking action of health promotion, in particular focusing on the increasing the accessibility for migrant and Asian communities, the current existing healthcare and social support services, so that they can be more independently prevent and manage their health conditions. Which means basically is that we promote your services and then programs that you have developed. If you feel like extending your services to those consumer groups or improve your service to be more inclusive for all, so we are happy to share our resources to help you, like our newsletter, which is published in the 3 different languages of the English, Chinese, Korean, and help you to get connected with those kind of population groups. And also you can join us our network meeting, where you can make your connection with them and then building network meetings. So in the meantime, so we raise awareness of health and well-being, and therefore we deliver on the educational health seminars to those groups. Actually, we did the same around 50 to 60 health seminars every year in collaboration with those healthcare and social service providers like yours. So if you are thinking of your service to be more inclusive for all, you want to extend your service to those groups, just talk to us and to me. So we are happy to share our experiences and provide cultural advice for free to you. Thank you.
Kia ora, Samuel. Thank you very much. Again, if you'd like to connect with Samuel, please message directly in the chat box or leave a message to be checked. Kia ora. Thank you. Kia ora, Monica. Welcome.
Kia ora.
On to you.
I'm Monica. I'm the Community Stroke Advisor for the Upper Harbour area, and my colleague Pauline Mitchell is also in attendance, and she's the Community Stroke Advisor for West Auckland area. So at the Stroke Foundation, it is the sole charity dedicated to the prevention of and recovery from stroke. So we do have those two different aspects as part of the organization. And then this is because of 11,000 strokes being experienced each year, which is around one every 45 minutes. So our services to help with this is that we have, as I said, 28 community stroke advisors all across New Zealand. So North and South Island, with the largest amount in Auckland. And we also have return to work service. We do have one return to work advisor in the South Island, and then we have our other ones located here in Auckland. And so more specifically, our community stroke advisor service. This is started with a referral from usually the DHB hospital, either stroke nurse specialists or the consultants. We do also receive individual referrals when people call up the organization. From there, we then make contact with the stroke survivor offering our services, which in general is information, advice, and support around stroke and recovery. So that can be seen in a variety of different ways, sometimes referring back into the DHB or to other community services that can be of some help. A lot of information and support, as well as connecting up with different community programs, whether that be around exercise after finishing therapy or support groups. And yes, and then our return to work service, we also refer into, and so that's helping them mitigate with their employers to help make a plan so they can typically gradually return to work and just be more successful in that role again. And then other aspect of the Stroke Foundation, as I said, is the prevention of stroke. And so with that, we do have a blood pressure van that during normal circumstances goes around to different community events or grocery stores, just offering free blood pressure checks and having some really good informative discussions around lifestyle choice and to help prevent high blood pressure, given that it is the #1 risk factor for stroke. And I think I went over, sorry.
Thank you, Monica. Kia ora again. Please connect with Monica in the chat, or how she has given you the opportunity to connect with her today. Kia ora, Monica. Gloria, Monica, and if you'd just like to also just invite people to, you can change your name on here, so you can rename yourself. If you look at your picture on the right hand side of the screen, you'll see 3 dots, and you can rename yourself there, and maybe you'd like to also put the name of your organization next to your own name. Kia ora, just an invitation, just so people can identify you easily. Gloria.
Hey. Kia ora, good morning, ni hao, everyone. My name is Gloria from CN Necessity Foundation, formerly known as Chinese New Settler Services Trust. So we provide social services, education, and employment, as well as the social housing service to the Asian-focused migrant community across the Auckland region. Annually, we support about 15,000 people in Auckland based. So I want to check if we could share our screen, because I prepared a little PowerPoint to get people easily understand our service. Thank you. So are we able to use the share screen?
Should be able to, yeah.
Yeah, it's not connected at the moment.
You're right, it should be now.
Okay, I'll just try again. Yeah. Thank you very much.
Welcome.
Okay, so so thanks for the invitation from Waitakere House Link. And we, as I mentioned, we registered in 1998, and we are the migrant-focused social service provider. We provide social services, education, and social housing, including the health and well-being services. And also we are the accredited provider for different government sectors. So our organization, we started from our founder, Jenny Wang's home garage in 1998. And at the beginning, we have no income for 3 years. And now we have developed to one of the largest Asian NGOs. And on the right side, as you can see, is our service center head office based at Penmu, but we do have the Saturday branch office across the Auckland region as well. We have 200 workers, including our staff, volunteers, and also contractors. And annually we serve about 15,000 people. This is the service structure we have. So as you can see, we have education, social service, and social housing, 3 key categories of our services. And this is our clientele. The languages we provide at the moment include English, Mandarin, Cantonese, Korean, Japanese, Shanghainese, Greek, Mongolian, Malay, Hokkien, and Hakka. So in terms of the health and well-being services, firstly, we are the NRHCC provider. We are now providing the timely and the intensive support for the COVID welfare support for Asian whānau and also Asian groups in mandatory isolation. So including the food support, non-food essential items, financial assistance, cultural language support, social services, and etc. And also we do the public health promotion. We have the information hub, and also we do health-related workshops, and we do the referral services and have the awareness and access support. For example, the COVID-related information, vaccination, New Zealand Health and Disability System promotion, as well as the diabetes, breastfeeding, etc. And in the meantime, we have the maternal and children's health promotion. We have the Healthy Babies, Healthy Future program, and also including the Healthy Meals, Active Moments as well. And also we have the positive parenting programs, and we have the follow-up one-to-one support for ongoing planning and support for behavioral changes. For mental health, we have the prevention and intervention services, including the mental well-being workshops, online Tai Chi, social work counseling service, anger management course, children's counseling, and whānau-centered support. So in terms of the Unite Against COVID-19 service, we started the response system during the lockdown period. And so far we have supported over 2,000 people directly, and including the welfare support, vaccination booking, food parcels, discretionary fund, financial assistance, online educational well-being service, and one-to-one consultation follow-up support, social housing service, multi-language support, and general inquiries. Okay, that's it from our organization. Thank you very much for your time.
Thank you very much, Gloria, for that extensive coverage of what
I try to make it short. Thank you.
Kia ora. Okay, te pai. I'm sure that all of that is valuable. So, and because we're having a change with the breakout rooms, because we've had a few technical issues, there's a little bit longer given there, so you might have noticed that. Kia ora, Gloria. Thank you. Rachel.
Hi, I'm Rachel. I'm the Parkinson's community nurse. I'm a registered nurse. I cover West Auckland and Rodney for people with Parkinson's, Parkinson plus Parkinsonisms, and a few other tongue twister conditions. We provide support, education and information for people with Parkinson's and their families, carers and health professionals. I run groups of varying natures, support groups, carers groups, women's groups, men's groups, but I also do one-on-one home visits. I access all the community services for them. referred to people like St John's for medical alarms, hey Sally, and to Poi, can't remember where Poi was. So basically my role is to keep people in their own home for as long as possible, as long as it is appropriate, and help them to navigate Parkinson's as a movement disorder. I think I covered everything. Yes. Oh, and my age range is 23 to 94-year-olds, and I cover all cultures, ethnicities. It is not a selective condition.
Kia ora. Thank you, Rachel. And you were really early, so thank you for your patience as well.
I thought it started at 10.
No, that's fine. So if you'd like to connect directly with Rachel, please do so in the chat box, and you can carry that on. Kia ora. Naima from, have I said it right, Naima?
Naima.
Naima. Yep. Kia ora.
Morning, everyone. How's everyone doing this morning? Good. My name is Naima. I'm here with my colleague June, and we are from the National Bowel Screening Program. So the Bowel Screening Program is a completely free program for those aged 60 to 74 years old, 50 if you're part of our pilot back in 2012. So those who are from 50, they might have actually received the kit. Our program is now live throughout Auckland, so all 3 DHBs have got the program up and running, so anyone there can get the test kit if they're within that age range, and we're also live in other DHBs too. So the bowel screening test, super easy to do. You do it from home. It only takes a few minutes, and once you've done it, you just this is actually what you need to do the test, this little tiny guy. Once you've done the test, you put all your details into a prepaid envelope that we've given you, chuck it into the post box. In about 2 weeks' time, we get in touch with you with your results. So it's a super easy test to do. You do it from home. So something to do during this lockdown period. So a lot of people don't know this, but bowel screening is our second highest cancer causing death in New Zealand. About 3,000 people get diagnosed every year, and 1,200 people unfortunately die from bowel cancer every year. So this is a really good test to do, you know, keeps us on top of our well-being, just like every other screening test. So if you would like any more information on how to do the test, or if you've got a test lying around and you're not sure if it's still good or not, feel free to get in touch with me. I can get a new test kit ordered out for you, or I can give you a bit more information on how to do the test. I'll pop my details down in the chat below, so feel free to get in touch.
Thank you, Naima, beautiful. Something to do during lockdown, yeah. So no, very important. So thank you for that, and thank you for being really efficient too with your kōrero, your information. So I'm just going to check, and I'm just going to stop a second and welcome in everybody else who finally got let out of the waiting room. So kia ora koutou. Thank you. We have had a couple of technical issues this morning, but we are all here together. At the moment, we are hearing from those NGOs from the Community Health and Cultural Services. So I'd love, Sally, for you to go next, and then I'll check if we've got anyone here from the Well Foundation and the Wilson Home Trust. And then I'm going to call up the Social Services and Child Health, and I ask you to raise your hand so you move to the top of the screen, and then we can work through everybody here, because we really want everybody to get the opportunity to share and to connect today. So thank you, welcome everybody. I can't see everybody on the screen right now, but I'm trusting that you're here. Please use the chat box. Juliet, kia ora, welcome Juliet. Please use the chat box, yeah, to communicate with each other. You know, you might hear something that you came here specifically for. So we won't be having breakout rooms, so please, we're going to use the chat box. We're going to use the space, and we are going to give everybody about a minute, 2 minutes, because we've had to push out the breakout this afternoon. So thank you all for being here. We started with karakia. Yeah, so we've done all that, and it's wonderful to have you here. We did have a look at our amazing Waitemata DHB staff who are here today, who have taken their time out to come and have a kōrero, and have a listen. So thank you all for being here. So Sally, over to you, and then we will go Juliet, Kapai. Thanks, Sally. I wonder if you're on mute, Sally, or...
Oh, I may be. Yes, I put it on, unmuted it. Hi, everyone. Sorry for that. For those that don't know me, my name is Sally Johnson, and I work in for St John's in the Medical Alarm Division. So I cover the whole of Northland and then half of Auckland. So my role really is to provide information, education and support for health professionals. My background's a registered nurse, and some of you may know me from my time with Parkinsons. So I know Rachel and a number of you very well from those days. So really, if you're wanting any information on medical alarms, please get in touch with me. You can email me at sally.johnson@stjohn.org.nz. And I can walk you through the best resources for you, the best way to refer online, which is quickest for you. Some of you already do that. I know Rachel and the ladies at Stroke do. So it's a very easy process. So it's just about giving you the tools that you can support the conversations around safety with your patients in the community. So yeah, so that's me. So feel free to get in touch, send me an email. Yeah, that's great.
Awesome. Thank you very much, Sally, and well done. Well done. Very efficient. Kia ora. Okay, so from the Well Foundation, Juliet, we'd love to hear from you.
Kia ora, everyone. So yeah, I'm glad we made it in here. I was waiting for a moment, but I thought I did do a presentation as well. So I'll just share my screen because picture tells the story better than me. So the Well Foundation is the official charity for Waitemata. So we are the official charity for Waitakere Hospital and all the community health services for North Shore, West and Rodney. And we started in 2014. And since then, over 7 years, we have made more than $12 million worth of projects happen. So I thought that I would just go over a couple of the projects we've done and we're working on out west. So some of you will be very familiar with the Skaboo project, which, as far as I'm aware, I started with Well Foundation a few years ago, but I think they've been talking about this since 2003. So it's finally being built. And the lockdown thankfully didn't cause too much of a delay. We applied for and got defined as an essential project, so we were able to continue working through level 3, so we can get this very cool project off the ground and up and running next year. And then last year we did maternity reclining chairs for Waitakere Hospital. So I just thought I'd pop in a couple of pictures of our West Auckland dads there enjoying their very comfortable chairs so that they can spend some time with their new bubbers. We also partner with community organisations like the Rotary Club of Henderson, who are just amazing supporters of our hospital. They last year redid the pond area out the back by the staff car park, and then this year they've refurbished the staff cafeteria for us and just put some nicer planters in there and given it a bit of a tidy up and some new tables. And some other things we've done is some support for the Muriwai ward for Parkinson's patients, so in the COVID-19. Sorry, I think someone maybe just needs to go on mute. Sorry. And see if there's anyone. When I say I can't tell who that is. Oh, Victoria, sorry. Would you mind just popping on mute?
Yeah, I've done it.
Okay. And the primary birthing unit, which is actually a social investment model that we are working on at the moment, and the business case has gone to the Ministry for approval, I believe. So we're just waiting to hear back on that. But this is some of the design concepts that we've received back for this unit, which is something I'm so excited about for Waitakere and for West Auckland. Just thought I'd pull in some of the pretty designs that they've given us. And again, our friends at Rotary Henderson have put forth an application to redo our child health play space, which is an internal play space courtyard in our child health unit at Waitakere. So those are a few of the things that we have been up to and are getting up to, as well as just whenever we have any donations through for staff, especially now during COVID, we're doing lots of support, chocolates and things like that for our wonderful healthcare heroes. So that's us.
Wow. Juliet, some amazing work. Ngā mihi nui. Ngā mihi nui. Kia ora. Thank you. Hey, so Wilson Home Trust, I think we've got Felicity here. Oh, well, it says Felicity. And I think you're on mute.
No.
Yeah, we can hear you. So we'd love to hear from you.
Good morning, everyone. My name is Felicity, and I'm the Service and Support Coordinator for the Wilson Home Trust. So the Wilson Home Trust is a registered charitable trust supporting physically disabled children, young people up to the age of 22 and their families living in the north of the northern part of Northland. So that is from Rangi up to the top of the Upper North Island. So the trust aims to give physically disabled children and young people support and resources that are not available through other agencies, and to help deal with challenges they may face. So the resources and information is advocacy and support for a variety of issues to do with the child's disability. So we also do grant funding. So we have different types of grant funding. So this is all for children with physical disabilities. We have an equipment and activity grant. We have a holiday grant, emergency and counseling grant. And we also support the families that is in rehabilitation at the Wilson Centre. And we do activities. So we do hydrotherapy activities. We do demonstration days and parent activities. So if anyone wants to contact us and have more information, they can do so. I'll put my email address and phone number on later. Thank you.
Thank you. Kia ora, Felicity. Thank you so much. Again, connecting in the chat bar, using that. I'm just doing a time check. So we're at about 11:10, and we did have breakout sessions this afternoon, and we've had some technical difficulties. So I'm just acknowledging us all sitting in here, you know, giving all our attention to listen. Acknowledging that, and just taking a short little break between speakers. Is it Gormita Prasad?
Yes.
Kia ora. You've come from Parent Aid Waitakere.
Yes, kia ora everyone. So we are Parent Aid Waitakere. We're based out in West Auckland. Our organisation has been around for 28 years now. So what we do is we provide temporary respite care services to parents and caregivers of children aged between 0 up to 14 years old. When we mean temporary respite care, that just means we have field workers that actually go out to homes and help parents in the home. So it may be in the form of childminding for baby, if mom wants to have a rest or a short break, just a little bit of help with some light housework like folding laundry, helping with meal preparation, or even just little things around the home that will help make things easier. And why we do this is because we have a lot of stressed parents and caregivers around who have absolutely no support out in the community. Most of them we do not have families in Auckland, or do not have any family support during the daytime. So disease for those families, usually the parents and caregivers, so that we can assist in the helping getting their load a bit lighter so that they can carry on with normal stuff. And why this happens is because most of the time, you know, things happen unexpectedly. Babies get sick, parents get sick, they have surgery, there's a new birth in the family, or there's some sort of grief, trauma, family separation. Things happen unexpectedly, and we are not prepared for it. So this is our service. It's a free service, and we are not funded by any government ministries. We depend on philanthropic funding, but we have been around for 28 years now, and we work in areas of West Auckland, from Newland up to Camille. We do a few central city areas from Grayling, Ponsonby, Mount Eden, and we are now in the North Shore as well. And the eligibility criteria is so that obviously the main parent caregiver is under considerable stress due to some sick or medically dependent child. Either parent has been sick, has had surgery, or dealing with trauma or grief, or mum has given birth recently, has at least one child under the age of 14, no family or friend support during the day. We also facilitate Ministry of Health clients for respite care, or ACC funded clients, and work and income for those multiple birth families. So all our services are in the home only. Because it's a free service, we have to restrict that to that being strictly temporary. So our free visits are 6 visits in total, with 2 hours each. And we work Monday to Friday between the hours of 9 AM to 5 PM in 2-hour slots. All our field workers are experienced in childcare. They have had child abuse training, are police vetted, and first aid trained. The way to make a referral is through our website. Jump onto our website. I'll also leave link to our website and my email address on the chat box. At the moment, we are not doing any home visits.
Sorry,
Yeah.
I'm just gonna.
That's okay.
Just gonna bring us down because I've realised, wow, we've got a lot to get through. So thank you so much. If you can put the rest of the details in the chat and a link to the website, because we can access links from the chat. So please do that. I just want to check. Thank you, Gomita. I want to check with the Waitemata DHB staff, because, you know, they're here, and I want to check if they could raise their hand again. The Waitemata DHB staff, if you're still here. Yes, thank you, Liz. Thank you. See how the screen changes? As I ask the Waitemata DHB staff to raise their hand, they go to the top. If you're not, you could put your hand down. Thank you, Liz. I just wanted to check in with you guys. How are you going? And are there any specific questions you might have so far? We've got quite a few other NGOs to get through, but I just want to check in with you guys and see how you're going, the Waitemata DHB staff, and see if there's any questions that you have so far from what you've heard.
Hi, so can you hear me okay?
Yes, kia ora.
Hi, I'm Liz from Infection Prevention and Control. My colleague Manu Patel has just had to step out. We're both at Waitakere. Today is my very first Aid Waitakere, and watching this is amazing. So we look after patients once they come into the hospital. We do a variety of stuff which is too big to tell you all, but for me, to be seeing all of you amazing people working in the community before people get here is absolutely amazing. So thank you to all of you. The part that's looking at your agenda, Hinamoa, is later on when you're talking about the hospital foyer refurbishment and planning. Those sort of, so apart from managing infections in the hospital with patients, we also look after the environment to make sure that the environment is safe. So we will both be very interested to hear that. Now, my colleague Manu has just walked in, so I've introduced you, Manu, and I've given a very brief rundown. And I think that's about all that you need from us, Hinamoa, and everyone else.
Yes.
Right? Cool, nice to meet you.
Absolutely, thank you.
Great to
and
be.
you too, and thank you. Wonderful, thank you. The great feedback. So everything that you are contributing today is being heard and received. So kia ora. I think that was it from the Community Health and Cultural Services group. And don't worry if you didn't get in there, we will make sure. So I'm going to ask now, Naima, we heard from you. Can we get the social services and child health? Social services and child health. If you could just go down to your reaction button and you'll see the raise hand, Yeah, and that will move you to the top, and then we're going to get you to share. Kia ora. Lynn, you've got your hand raised. Ka pai. So on the list, I've got problem gambling, which we've heard from, Salvation Army, Yellow Brick Road, e Tipu e reo whānau services, Parent Aid, who we've heard from, and pregnancy help.
Sorry, Hinamoa, I haven't spoken yet from Problem Gambling Foundation.
That's good. That's good. You're going to speak now. Shael.
Perfect, thank you. Ko Shael tuku ingoa no Fiji aho e mahi ana o hei pōhiwa ki PGF Services. So kia ora everyone, my name is Shael and I'm a health promoter for PGF Services. Apologies, my pēpi is sitting here next to me and he's a bit distressed, so you might just hear him chime in. At PGF Services, we provide free, confidential and professional support to anyone impacted by gambling harm. So that means support is available for gamblers as well as their friends, family, whānau, colleagues, anyone really. And we also work to ensure that our support for our Māori clients are culturally appropriate and mana enhancing. Our dedicated public health team connects with communities to raise awareness of gambling harm and support community wellbeing. And we can also provide education and training for staff to identify and screen gambling harm. We can provide guidance to develop organisational policies on gambling harm. And we can also just come out and provide any fact sheets or information resources, briefings, and share any other research on gambling harm in New Zealand. So thank you very much for this opportunity to share a little bit about what we do, and I look forward to hopefully catching up with everyone in the near future in person.
Kia ora, Shael. Kia ora, thank you for that, and go well with the Zoom working from home whole thing, eh? Kia ora. Okay, ka pai. Who else have we got here? Gina, you got your hand raised. We've got Giselle, we've got Joseph, I think. Yep. And so what we might do is we might just, the ones that were on the agenda, we might just do them first and then we'll make sure you get a chance as well. Is that okay, Joseph?
Yep. Okay. So Oasis is a gambling service as well, very similar to PGF. We see all people regardless of their gender, culture. We have one-to-one counselling, face-to-face. We run some groups. There's a women's group at Mount Wellington. We do support and education groups. We also do counselling for people that aren't the gambler, that are affected by someone's gambling. We're not although the Salvation Army is faith-based, we're actually kind of independent of that. So we don't really have any religious view that we're trying to advocate. It's just open to everyone. We're all, the team is all trained, qualified counsellors. So we operate out of a variety of areas. I'm based in Waitakere at the Salvation Army Bridge. We also have office at Albany, Mount Eden, Mount Wellington, Manukau. So just sort of try to cover as much of Auckland as possible. So if you want more information, you can just go Google us, Auckland Oasis or Oasis Salvation Army, and the information there. Okay, thank you.
Kia ora, Joseph. Thank you very much, and I encourage you to put your details in the chat box too.
Okay.
Kia ora, Giselle. Is it Giselle? Giselle? Yellow Brick Road, is it?
Yes, hi everyone. My name's Giselle. I'm from the Yellow Brick Road. We used to be called Supporting Families. So we support families who have a loved one who's experiencing mental health distress, and that can be anywhere from a teenager who's got depression all the way to someone who's been hospitalised with serious mental health struggles. So if you've got someone in your family who's mentally unwell, you can contact us for referral easily, or you might ask your health professional, but you can refer yourself. So we provide support, as in one-on-one support for people in how you can effectively communicate with someone when they're mentally unwell, how you can escalate getting support if you need to. We also run support groups and education classes around different mental illnesses, and we also provide information and advocacy. So often when people have loved ones on a mental health unit and they don't know much about what's going on, we can help them to get the support and understanding that they need from us, but also questions they can ask at discharge meetings, how they can contact mental health services when they're struggling. And sometimes we work with a family just as a one-off. Other times we might see them for 2 years while they're learning how to adjust to life with someone who's mentally unwell. Our services are all free and we're funded by the District Health Board. So we're part of the mental health wraparound service in making sure that everyone's on the same page around someone's mental health. But you don't need a diagnosis. You can just contact us if you feel that you need some support around what's going on for someone that you love.
Kia ora, Giselle. Thank you so much. Thank you. And please connect with Giselle in the chat box too. Kia ora, Ivan. So we'll have one more. We'll have Ivan, and then we're going to move into, we're halfway through. And so we'll move into the cancer services and support after this. And don't worry, if you feel like you've missed your spot, you haven't. We definitely, as I said, we're not going into breakout rooms. So we're going to use this time to continue to share. Ivan, we did have a talk about Asian family services. Is that what you were wanting to share about?
Oh, did you?
Yeah. So we'll just quickly.
Yeah, sure. I'm from Asian Family Services, which is funded by the Ministry of Health. And I'm the Deputy Director and Public Health Lead. Asian Family Services provide gambling harm services as well for individual as well as family, especially for Asians who speak Mandarin Cantonese, Korean, Thai, Vietnamese, Hindi, Japanese, and Korea. We also run an Asian helpline that is from 9 a.m. to 8 p.m. answered by qualified registered counselor in New Zealand. So I will pop in the 0800 number here later on. And again, the language include Mandarin, Cantonese, Thai, Vietnamese, Hindi, Japanese, and Korean. Another things that we do is we also have the Ministry of Social Development contract, so we can help with support in terms of social work. We also have discretionary funds that help with food puzzle for time being. One more thing is we just launched a new service called Digit Language Service, catered for primary and community services that can provide 26 Asian language. And there are 4 types of services available, which is telephone, 3-way conversation support, video conferencing, appointment confirmation service, and follow-up with translated only. And we are also able to provide print resources. This is currently funded by the Ministry of Health for up to 1,400 free services. So if you are unsure about what it is, you are very and most welcome to pop into the web link later on, so that then you can talk to someone or register your organizations. Thank you so much.
Thank you so much, Ivan. Kia ora, and please do pop that into the chat box. So I think Jude, have we heard from Walsh? No. Kia ora, Jude, I think you're on mute. A big thank you from Kay Lindley in the chat box. Jude, were you wanting?
Yeah, sorry. I'm trying to get past the text box here and actually get in there. Yeah, so I'm going to be brief because I've been typing it in, and I'll put it in chat. But I'm the Health, Wellness, and Personal Development Facilitator for Walsh Trust. We're primarily known for mental health. By the way, my services, I see somebody asking about anxiety in youth. I've got a weird contract under MSD, and I support from 16 to 60. Basically to 65, though that can carry on a bit. People on a benefit usually, though I can get special dispensation for others at times, with anybody with a barrier engaging with their community and or employment. We also have employment works at Walsh, which I will refer people over to when they're ready, kind of deal, but there's no employment outcome expected from what I do. If somebody gets into work, that's great. Mostly I get people into volunteering opportunities, and that can be Project Twin Streams, for instance. So yeah, if you want to get a hold of me, I'll put everything in the chat box there for you. Yeah, we have a lot of other services as well. Maternal mental health, we're a tenancy provider as well, all kinds. So yeah, if you want to know anything about mental health, period, then just get a hold of me. And if we don't provide it, I'll probably know somebody who does.
Wow.
Thanks.
Thank you so much, Jude. Kia ora.
Yeah.
So have we heard from your organisation, Sue? Kia ora, Sue. Got your hand up.
Yeah, sorry. Yeah, somebody, you said that you'd heard from Literacy Waitakere, but
yes, we have.
Who did you hear from?
Great to see you. Who did we hear from in the beginning?
Yeah, I don't know who you heard from because yeah, I'm the new manager, and so I don't think anybody else got the invitation. So there might have been a bit of confusion there. So just wanted to quickly say, so kia ora koutou I'm Sue West, and I've only had 1 month kanohi ki te kanohi with my staff before lockdown, so new in this role. However, so I've replaced Jane Gilmore, who many of you may have come across in the past. So we work with the 40% of people in New Zealand who are find literacy, numeracy, digital literacy a challenge, and there are 40% of our population. One of the new programs we've just doing, that's why I wanted to get in there, was to do with digital literacy, which is a hugely big issue at the moment. So we've been providing Chromebooks and subsidised internet to whānau for adult learners. So I just wanted to put that in there. The other thing is our name is Literacy Waitakere, but we are moving outside of Waitakere. So we won't be restricted by that geographical area. And another one thing I wanted to say is we are doing a project with Auckland Libraries for adult literacy readers, because all of the libraries in Auckland, they want to attract people who have low literacy levels into the libraries. So we've started to produce some books that have now been catalogued into 16 libraries in Auckland for whānau to go in and have a read.
Wow.
One who worked at the Crown Lynn factory in the 1960s. So our learners write these books. But the digital literacy program is there. We're closing it off for this year very, very soon, but we're going to be going into it next year. And that's it from me.
Oh, kia ora, Sue. All the very best. It sounds like you've come in and really hit the ground running. So
we can't muck around. Our country's in a desperate situation, as you all know. So
absolutely. Ka
yeah. Okay. Kia ora for that, honey. More, and I have to go. So that's another reason why I have to push in.
Ka kite. Okay. So excellent, everybody. I just want to stop for a second, just a few seconds. I think listening is a really great skill and it takes energy. So, you know, just have a look away from your screen. If you need to turn around, turn left, turn right, just doing a bit of health and safety. That's the one. Have a bit of a stretch. You know, when we're looking at a screen like this for this amount of time, we just need to be aware. Let's be aware of ourselves as well. So excellent. I would like to just have a little break before we go into the for the presentations, before we go into the cancer services and support. So I can see here on my list, I've got Bowel Cancer New Zealand, Bowel Screening Program, Breast Cancer Foundation, Cancer Society, and Leukaemia and Blood Cancer New Zealand. So if you just raise your hands. Thank you, Deborah. Thank you, Dan. Thank you. You'll come to the top of the screen, and that way we'll know who to get to speak next. Kia ora koutou, but I do want to have a little break from that. And I want to just talk about maybe some of the updates. And I think it was Liz, or was it Liz, earlier that said, oh, you know, I'm interested to hear when we get down to the updates, but because we're not having breakout sessions, I think we better break it up a little bit. So we have 2 more groups to go to hear from. You're all doing amazing. Your presenting is on point. And so well done, everybody. After the cancer services and support, we will have the long-term conditions. Those group of services present, and that'll be Diabetes Auckland, Disability Connect, Epilepsy Foundation, Hospice West Auckland, Muscular Dystrophy Northern, Neuro Connection. We've already had Parkinsons New Zealand and Stroke Foundation New Zealand. So that's how it's going to roll out this afternoon. Everybody still with us? Yes, I got some nods and a thumbs up. Thank you, Robin. Thank you, Sally. You're all doing amazing. Ka pai, Rachel. Okay, so Tracy, am I doing that update or do we have someone? Just checking. Where's our Tracy? So I will carry on until I hear from her. So just nod. Tracy, is that me? Ka pai. Okay, so in our last meeting, we did some consultation with the DHB on the hospital foyer refurbishment, and it was a great meeting, a great turnout. And I don't have an official update, but Tracy will send that out to everybody if you'd like to get it, who has attended the meeting. Is that right, Tracy?
Yep. So, so we've been officially confirmed that there will be an NGO area in the new foyer refurbishment, as well as a mum's room. It's been identified in the new design. So that's so exciting. We're working 10 years for that. And finally, we have definitely. So it's really exciting. We've I will try and keep everyone up to date with information because the design's not complete, and so we'll need more feedback from NGOs about how that little area might work best and how to utilise it the most for staff and patients. That's me.
Oh, thank you so much, Tracy. So, everybody, you will get that update from Tracy. And I thought, hey, let's just stop a minute. Let's have a bit of an update and let's get ready for our next set of presentations. So kia ora, Liz. Thank you for holding out, for still being here, you and Minu. And I hope that update was somewhat helpful. Congratulations to all of you who contributed over the last 10 years to get that happening in the foyer. So if you came to that meeting and you contributed, you were part of that. And as you heard from Tracy, we will continue to get more feedback as the design progresses. Ka pai, kia ora. Okay, so thanks for that. We had a stretch, we had one of the updates, and I think we're going to start with you, Deborah, if that's okay. And again, we're giving everyone about a minute 45. So okay. Thank you, Deborah.
Kia ora, everybody. Great to be here alongside you all in these strange times. The Breast Cancer Foundation, we've got 4 main pillars where we put money back into research, which is important to keep on target to reaching our vision of 0 deaths. Education is a big bit, and my role as the National Breast Health Educator takes me right across Aotearoa, and I've just come back from Wellington. Sorry for the Auckland lockdown, but I got a little bit of freedom. We've got Pinky, our pink caravan, down in the Wellington region at the moment, working its way up Palmerston North across to the Hawke's Bay by the time early December comes. And we're getting really some great interactions with the general public. And unfortunately, it keeps coming up that women are not getting their mammograms in a timely manner at this stage, because of COVID. And so even the 45-year-olds are not being screened for maybe up to a year after their, due date. And we as a foundation realise, and you may have seen during October, Breast Awareness Month, 133 missing women. And that's those women that we estimate have breast cancer but don't yet know about it because they haven't been able to have their screening mammograms. So we're trying to track those women down and try and get them in a timely manner. Support is really another pivotal part of our service, and we have an 0800 BC nurse line. So anyone can ring that, but predominantly we like to hear from patients when they're newly diagnosed. We send out patient bags, heart pillows, drain bags, seatbelt cushions, give them a lot of practical support right the way through the whole of their journey through the breast cancer. And of course, advocacy. So we continue to push government to raise the breast screening age to 74. They had said yes, COVID has interrupted that. They have put money into breast screening Aotearoa to get their database system up to handle that. And eventually it will be an opt-out program with breast screening instead of an opt-in, which is really great. So please, give our nurses a phone call. We're even virtually up and running, doing educations over Zoom across the country. Thank you, everyone. You're on mute, Hanima.
Oh, Eileen. Kia ora, Eileen.
Kia ora koutou. My name is Eileen Brown. I'm the nurse manager at the Cancer Society for Auckland. We're based in Grafton. I've got a team of 11 nurses who cover the entire Auckland area. For West Auckland, the nurses are Jan, Sandra and Jan, and they're on here on the screens today. They work Monday to Thursday, 8 till 4, providing support and information to patients who've been referred to us. It's not an automatic referral. Patients think that the Cancer Society are told as soon as somebody's diagnosed, but we need to wait until we get a referral from the GP, the hospital staff, or the patient themselves. Once referred, the nurses do an initial home visit and thereafter keep in touch with visits or phone calls. Obviously, at the moment, that is just phone calls. Nurses support people from the cancer diagnosis through their treatment, helping them manage any side effects, any problems with medication and with the hospital system. They also refer to other agencies like Canteen, Look Good, Feel Better, dietitians, etc. We've got a psychology team for anyone over 18 with a cancer diagnosis at any time and or their close family members. And this is to help with the emotional effects cancer diagnosis can have. We've got volunteer drivers for people who've got no family, friends, or any kind of transport, and it depends on some criteria. For example, the treatment times need to be between 9 AM and 2 PM, and it doesn't cover areas like Piha, Huia, and Kaupapa. There's just not enough drivers in these areas to support that. We have a Chinese liaison nurse who works 2 days a week and a social worker that we can access internally. This support is paid for by donations from fundraisers like Daffodil Day, Really for Life, Walking with Stars, and it also funds cancer research and health promotion. Obviously with COVID, we've had a real hit to donations and we've had to go online for those. Domain Lodge, the building in my background screen, is accommodation for those patients who live more than 100 kilometres away from Auckland City Hospital and need treatment. It's open to the public at weekends and that helps raise funds. The national 0800 number is available for any questions about cancer treatment, and that's answered by cancer nurse specialists. We've also got a new website with lots of resources. Just select the Auckland region, and referral forms are on the website, or ring the 0800 number, and I'll put that in the chat. Wow. Thank you.
1 minute 45 exactly, Eileen. Kia ora. Thank you very much. Thank you very much. Look, I'm aware that we've got about another 10 or so people to present. I really want everybody to get an opportunity to speak. So I encourage you for some of the detail to put it in the chat box. Is that okay with everybody? Just so we can at least hear your voice. Kia ora, thank you. Could we hear from the Leukaemia and Blood Cancer New Zealand? I'm sure I saw someone.
Hi, yes, you saw me.
Kia ora.
My name is Annette from Leukaemia and Blood Cancer. So we're a national charity dedicated to the care of patients and their families living with a cancer of the blood. About 8 people are diagnosed every day with a blood cancer, and it's the primary cancer for children. So the presenting symptoms can be quite vague, quite innocuous, but once you're diagnosed and under treatment, it can have life far-reaching impacts on your life and your well-being. So that's where we come in with the support. That could be psychological support in terms of support groups, Facebook, one-to-ones. Can be education. We have lots of booklets, and practical support. We have vouchers, we have information, we can sometimes provide Uber. We're advocates for blood cancer. We fund research at the Mulligan Institute, and we raise awareness of blood cancer, both medically and in the public. So Leukaemia and Blood Cancer New Zealand, we hold a vision to cure and a mission to care. Any more details, please look at our website, LBC or Leukaemia and Blood Cancer. Thank you.
Thank you so much. Very clear, very clear. Kia ora. Thank you for that. Okay, ka pai, and we did hear from Bowel Screening, Bowel Cancer New Zealand, Breast Cancer Foundation, Cancer Society, and Leukaemia and Blood Cancer. So amazing work being done out there. Kia ora. Right.
Sorry, Henny more. It's Victoria. Yeah, from Bowel Cancer.
New Zealand.
Yeah.
It's your turn.
Sorry. Just jump in real fast. We're slightly separate from the bowel screening program. So we're a national run charity that covers the entire length of New Zealand with anyone with a diagnosis of bowel cancer, their whānau who are supporting, or anyone who has survived bowel cancer. So we're a pretty big spread, very little team. We all work remotely. So we're very patient focused. We have a members only Facebook page, which is then divided down a little bit further. I'm one of the moderators. I'm the National Nurse Support Coordinator. There is me. So the 0800 number we have is manned by me on the hours that I work, but I'll put all the details in. We also have funded physio for patients and funded counselling for patients in their immediate whānau. We also have links in with HealthLink so that GPs can refer patients through to us should they need any other further support. We're just getting into workplace wellbeing talks as well as community wellbeing talks. So if there's organisations out there that would like to have some more information around bowel cancer and things like that, I'm available to do that. Nationwide and in Auckland, as soon as Aucklanders are, of course, allowed out of Auckland. And yeah, we also have a role within awareness, advocacy and education. So we have our finger on many things, but I will put all of my details into the chat right now. So, kia ora, thank you.
Kia ora, Victoria, and thank you for your patience. Yeah, so amazing mahi going on out there. I want to, we're going to move into bringing up now the long-term conditions, and you would have just been categorized like that. So Diabetes Auckland, Disability Connect, Epilepsy Foundation, Hospice, Muscular Dystrophy. Could you just raise your hands and we'll come to the top of the screen, and then we'll also be able to see anybody else that hasn't had the opportunity as well. So it's 1:45, knowing that we're going to get an update. I just want to check how our Waitemata DHB staff are doing. Could you just give us a, let's have a, shall we have a one of these? One of those. If you are from the DHB, Waitemata DHB staff, if you could just use your reaction button so we could see. Oh, there's so many people here. Michaela, Orias, Kapai. And is there any questions? You're still here. Excellent. And if there are any questions that you have at the top here from the people that you've heard about already, I encourage you to connect in the chat box. And also I'll give you a chance at the end of this. So kapa everybody, let's do this. We're all going to get a chance. And I might say 1:30 now. Okay, kia ora. Let's go, Robin. Kia ora, Robin.
Thanks so much, Anima. I do have to go as soon as I finish speaking. I'm from Disability Connect. We're an information service. We operate across the entire of Auckland. We generally help families or people with disabled people that they know with helping them through navigate the system. We do seminars, support groups, workshops, manner of things, including a transition expo, which we have over 100 stalls. It's meant to be tomorrow, Wednesday, sorry. It's now going to be in March. And that covers any manner of things when a person leaves school. Yeah, but primarily most of the diagnosis or most of the people that come to us have either an intellectual disability or autism are primarily the inquiries that we get, but the inquiries are vast. Thank you so much for the opportunity. I do need to go, and my details are in the chat box. Have a lovely day. Thank you.
Kia ora, Robin. Just before you go, if we did this again, would you come back and give a kōrero?
Absolutely.
Excellent. Excellent. Okay. Thank you very much, Michael. Being so patient there, Michael. Kia ora, Muscular Dystrophy Northern. Thank you, Michael.
Kia ora. Yeah, so I'm from Muscular Dystrophy Northern. We're the northern branch from the Muscular Dystrophy Association of New Zealand. My role is as a field worker. So essentially, I go around supporting families. Well, actually, let me first say that we're a member-led organisation. So we support obviously people with neuromuscular conditions. There's a bit over 60 conditions that we support, and we're talking some of them are quite rare, where we might even have 1 or 2 people in New Zealand. The Fieldwork service is essentially an advocacy general service where we support people, make sure they're getting access to all the services and supports they require. We're involved with schools and education, WINS, all those basic kind of needs that people have, as well as obviously specialist needs, supporting people to get access to equipment and things. So the northern region is from the top of New Zealand down to Taupo, so it's quite a large region that we support. What else is there? We have a small trust that our members have access to. We're also a DPO, so we're involved with that as well. Yeah, it's very, very broad, what we do and what we support. So we're just here to help the full thing, not only the people living with the condition, but also their family and extended family, because obviously that has the impact on the person and everything like that. So yeah, we attend clinics and all that when we can. Obviously, seems strange being a field worker since I'm not out in the field, I'm stuck at home, but looking forward to a time when we can do that. But yeah, that's it. So again, please, if you know anyone or anything like that, please pass this on. Thank you.
Kia ora, Michael. Thank you very much. Thank you. Kia ora, Lynn.
Kia ora, everyone. Thank you for having me. I work for Epilepsy New Zealand, and I am a female Michael. I do everything that Michael probably does, just for people with epilepsy. My main role is to educate and support families and disseminate information and things like that, and give support to people. I do a lot of training, public speaking and training in rest homes, daycares and schools, trying to basically remove the stigma of people with epilepsy and having seizures. I work a lot with people, organisations like Idea Services, supported living and things like that, whereby we train the staff and care workers to support people with epilepsy. As Michael said, we do advocating and things like that. I look after the Waitemata DHB area, and I have a lot of clients. There's about 10,000 children in New Zealand with some form of epilepsy. You can contact me via the information I'll put on the chat, or if you go to Epilepsy New Zealand website and have a look at that. Thank you.
Kia ora, Lynn. Thank you so much. Kia ora. We've got Neuro Connection admin, and I'm sorry I don't know your name.
Hi, my name is Tom Hoey. I'm the chairman of Neuro Connection Foundation. The Zoom setups just put names in when you set up the accounts. Anyway, so we are based down in Tui Glen. We own that big building in there in the park, and we provide holistic, preventative and rehabilitative services to the long-term care, mostly for clients who are stroke victims, or make up the majority of our client base, but we do have clients with Parkinson's, multiple sclerosis, cerebral palsy, etc. And we're also starting to work with the Guillain-Barré Association in New Zealand, because that's a neurological disease that is not covered on the most of the other criteria. So the approach for us is focusing on improvement in strength and motor skills, coordinative, but adding the social aspects to it. We have rehabilitation consultants. So we work in a team, mostly environment, while we do have some seriously disabled clients who are one-on-one. The majority we try to work in a class environment. So it's trying to get those people that have strokes and other neurological motor functional diseases away from their houses and away from that isolation and into an environment where they A, get the rehabilitation they need, but B, get to sit down and talk and have a coffee and meet with others who are in a similar condition than they are. So I've only been there since February. I found it by accident when I had Guillain-Barré. So what we've been trying to do is reinvent ourselves a little bit. I say our role is complementary to the outpatient role. So it's complementary to, and Monica from the strokes area has been coming and joining us. So we think we are complementary. So when patients are discharged from hospital, they get their physiotherapy. We are there then to pick up that long-term care, should it be necessary, alongside what Stroke Society and others provide. So Yeah, so listen, we also have space, so we're also looking to attract like-minded providers to come and join us at the centre. We've got about half of the space available to lease. So thank you. It's a pity we've got.
I don't mean to be rude, but I'm going to say, would you be able to share that in the chat as well, so that people can connect?
Thank you.
Thank you. What have we got? Marian. No, Marianne. RWL. Kia ora. So we've got 3 more, and we've got like 6 minutes. So we use the chat box and just introduce yourself. So kia ora.
Morning. Good morning, everybody. And thank you for inviting me. I'm a student transition coordinator, and I work in Auckland. Our area is between Bombay and Te Hana. We work with 16 to 21-year-olds who are leaving school. There are 7 of us in Auckland, and we work as a team, even though we work with different agencies and we're employed by different people, but we've always worked as a collective team. So our role is to assist students in their transition from school, and all the services that go with that. So things around.
Thank you.
Okay, I'll put my details in the chat box.
Thank you, Marianne. RWL stands for? It'll go in the chat box. Ka pai. Kia ora, Diabetes. I'm sorry, that's not your name, I know, but Diabetes New Zealand. Hei a koe te wā.
No. Yes. My name's Rebecca Irvine. Can everyone hear me all right?
It's okay. It's a little bit in and out. A bit of feedback.
Is it working a bit better now? All right, sorry for the delay there. So my name is Rebecca Irvine, and I'm based in West Auckland. I'm the West Auckland Support Coordinator for this area. I'm also starting to work a bit more in Central Auckland as well. We're in the middle of trying to find new initiatives to help people who are diagnosed with diabetes, because our organisation is very predominantly to do with people who are, not realising they're diabetic or needing help once they've first been diagnosed. But we're looking at more of the long-term scenarios and problems that occur for diabetics and their families. So I'm in the middle of investigating that. So I'm looking for other organisations to help me to build a better network to find out where it is that people, for example, the Stroke Foundation or the Mental Health Foundation, have got diabetics that are having troubles that we could actually assist with them to help, such as diabetes distress, or just the fact that someone sort of primarily sometimes the complication that led to their stroke is diabetes, amongst many other things, and that to do with socialisation, especially in the pandemic and everything else. So thank you for this. It's really a good opportunity, because I'm in the starting all this off, trying to get bigger support networks and better socialisation for diabetics, both old and young, and just general advocacy and welfare, because there is a real big void.
Ka pai. Kia ora. Thank you very much, and we're going to end on.
I'll put the details in the description.
Oh, thank you so much. Sorry, the feedback is getting stronger, so I think maybe put the details. Kia ora. Thank you for the work that you do. And Dan, I think we're going to end the presentation with you just very quickly so we can wrap up.
Hi, I'm Jan. So I'm one of the nurses with POI at Hospice West Auckland. So POI actually stands for Palliative Outcome Initiative. This is across the whole Auckland region, across the 5 specialist hospices. We're in MDT, advisory, consultancy, education, support service for primary clinicians, for GPs, practice nurses, for rest care staff, for pharmacists. Increasingly, we're networking with community NGOs, and we are supporting clinicians to look after people at home who are in their last 6 to 12 months of life, who it doesn't matter what condition they have, as long as they last 6 to 12 months of life, and who are not needing or doesn't qualify for hospice specialist palliative care services, because a lot of people think everybody will just go to hospice at end of life. Actually, you know, hospice is a specialist service. Not everybody needs hospice at end of life or want hospice, and we're really trying to capture that transition from long-term chronic conditions to like maybe the last stages of the long-term chronic conditions. Yeah, and I'll put our website in there, and we've got an email as well. Thank you.
Kia ora. Thank you so much. Thank you, everybody. That was a big task to get everybody, and I think someone may have missed out even, and I really apologize for that. But I would love to know if we did this again, if we had a Zoom forum like this for NGOs and Waitemata DHB staff. Can you pop in the chat box? Would you be interested in attending? Yes or no? Just yes or no. Ka pai, thank you. Yes, yes. So we know whether we should do this again. The other thing, great, there's lots of yeses coming up. So I'm trusting that this has been useful. That's what I'm trusting. I would love to get the hands raised of the Waitemata DHB staff just one more time before we wrap up today. I know that it would have been great to have breakout sessions, and we will work on our Zoom account in the meantime, where you can actually go to the room and talk with the people that you are most interested in. Yeah, or that you need to connect with because of your work. Tracy, I'm just going to check with you because Tracy, you did an amazing job of bringing everybody together here today. Tracy, where are you? Can you raise your hand, please, on your taskbar, so you go to the top so people can see you. And I'd like to say thank you so much, Tracy, because you spent days and hours working all of this out, and then we had a technical issue and we winged it. So you guys did amazing. Thank you everybody for your presentation. I just want to say, you know, from Waitakere Health Link, that we appreciate you attending today. I'd like to check in with the Waitemata DHB staff just before, and Tracy. Tracy, before I close, yes, please.
Can I quickly do the update?
Yes, please.
So
if you need to leave, please do. Sorry.
In March, HealthLink hosted a community workshop for the master planning for the hospital. The outcome of the workshop have supported an overall Waitakere master plan. There was a separate project to develop a business case for additional medical beds and an ICU. The case for the ICU was initially rejected by the ministry, though the beds were funded. But subsequent lobbying and the advent of COVID-19 have changed that position, and the ICU has since been provisionally approved as well. The master plan has been approved by the DHB board and other DHBs in the region and will go to the ministry for approval in November. Assuming the final steps go well next year, we will we'll be starting the next stage of planning for the medical beds and ICU, and also preparing the business case for the first tranche of the master plan, which includes the child, woman and family complex. The other update was from the New Zealand Health Reform Transition Unit. The road shows, I found out, they're not advertised yet, but Auckland one is, for Auckland DHB, is 19th of November, Waitemata is 25th of November, and Counties Manukau's 26th of November. The government's also announced the establishment of a ministry for disabled people, hosted by the Ministry of Social Development. So I'll send these updates so you can have a good read and absorb it all. Thank you.
Oh, thank you so much, Tracy. You did exactly what you asked me not to do. So thank you so much. You're onto it. You've provided the space Tracy, is there anything else you'd like to know from the group before they leave in the chat box?
If you didn't RSVP, can you put your email and address so I can send you the information, especially the staff? And thank you for your time. I know you're really busy over there at the moment, and I think everybody really appreciates your time out, and some people are doing it in their own time. And we just really appreciate all the work that you're doing for the whole community, as well as making time to, you know, be here with us. Thank you.
Tracy and Hinemoa, can I just ask one question? Or for those of you who don't know me, Kay Lindley, and I'm Deputy Chair of Waitakere Health Link. I just wanted to know, after March 2020, when we first went into lockdown, from then, how many put a crisis plan or a plan B with their organisation in case this happened again? I'm doing a bit of work with that with our groups in Glen Eden, and I just wanted to know, did that happen? Could you raise your hands if you did, if you put a plan B, a crisis plan in case we went into lockdown again? Okay, thank you.
Kia ora. Thank you, everybody. We have gone 4 minutes over time, so I value your time. And thank you, Kay. I want to acknowledge you as the Deputy Chair, and to the other members who are here. I think it's Zari, Sam, I think I saw David. So thank you very much. Let us close our meeting, and we look forward to seeing you at another opportunity. Thank you for the feedback. We will take that forward. Me inoi tātou. Kia tau, kia tātou katoa, he ata whai o tō tātou ariki ai hukaraiti, me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu. Ake, 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 amene. Have a good day, everybody. Take good care. Kia haumaru te noho.